I don't think anybody's had this unique experience. I mean, you had the opportunity to listen to patients who were most impacted by the Medicare system, and I appreciate all of your comments and to take the time out to be advocates for yourself and patients. And as a practicing nephrologist taking care of patients every day, I truly am proud that you are representing my patients that I'm going to go home to tonight and see on dialysis. So I really appreciate that. As advocates for the entire kidney care community, we voice strong support for reform of the ESRD program, which includes reforming the current MSP provisions. Early identification, prevention, and disease management are critical. They're good for Medicare, they're good for taxpayers, and they're good for our patients, as you just heard. We in the kidney care community are dedicated to working together with you to improve the quality of care for individuals with chronic kidney disease. And again, I want to thank all of you for coming. I want to thank the patients, in particular, the Kidney Foundation, and those of you who took time out of your busy schedule. This is an important issue for the patients and for all of us as we move forward. So thank you for coming. And we can open this up for some questions from y'all. Well, there's been a lot of discussions going on. They have not officially released their comments at this point. The question is where it's going to sit with the MSP. I don't think we can specifically say at this moment. We're hoping it's going to be 12 months. If they're listening to what we just heard from 4 individuals, it'll be 12 months.
What if this bill doesn't pass?
Well, we have been working over the last 4 years in a continued effort to accomplish our goals, as you've just heard. We will continue to work at it. There are programs in place that are educating patients today. Unfortunately, they're not funded for. But we will continue in this effort, going into next year.
Is there something specific that's going to happen that is not happening now? Is there anything that will change in the treatment of dialysis patients and kidney care patients if this bill doesn't pass?
We're going to continue taking care of patients in a high-quality fashion that all of us do today. That's going to persist. We have a great track record for quality outcomes, even under the current system, and we'll continue to pursue that as we move into the next Congress to get the bill passed.
What's going to happen is that people like me who began dialysis on an emergency basis because we weren't educated and we weren't aware, those numbers will stay steady or increase because of the increasing prevalence of diabetes and high blood pressure in our society. They will start dialysis weaker physically and have a less chance of survival. Furthermore, they will be more of a financial burden on the Medicare program eventually. So bottom line, there's already a lot of people who are dying too soon from kidney failure. And there's already too many people who experience kidney failure who didn't have to experience kidney failure. The longer we wait until we modify the ESRD program, it will be a burden financially to Medicare, and it'll be a sad day for the patients and for their families because they were not aware and they were not educated. I think that's a more direct answer to your question.
Because these patients don't just walk in one day and all of a sudden they discover that they have kidney failure.
Yes, they do.
That's an extremely common problem that we face.
So these people have not been seeing, in other words, what I'm saying.
They have not been.
mentioned this student, for example, his own student. It is an extremely common problem for someone to come into an emergency room who has kidney failure and needs to undergo emergent dialysis.
Okay.
Emergency.
And under those
How would the what is preventing people from getting education now from their doctor?
Can I take that one? I actually had what I would call a life-changing experience on my 43rd birthday. Was a migraine headache that I could not take care of. What it was hypertension caused by kidney disease. I went to my doctor, and for 4 months I was treated with hypertension instead of kidney disease. So even our own medical community needs to be educated on the fact of chronic kidney disease. I went through 4 months of treatment or being treated for symptoms that had nothing to do with the cause. So any kind of pre-education to stage 4 kidney patients is going to make the quality of their life better, their health better.
And I would echo that by saying that I went to see my doctor for a regular checkup, and my blood pressure was 230 over 130. He sent me immediately to a nephrologist who hospitalized me immediately, and they did tests on my kidneys, and they found that they were basically burned out from the high blood pressure, and that within a very short period of time I would require dialysis to stay alive. And I am not a unique case by any means of the imagination, as the doctor can tell you.
Unfortunately, the symptoms of kidney failure do not present themselves. Your kidney function is less than 20% of normal. So you can go along thinking everything's okay, and your kidney function is 15 or 20% of the normal, and really have impending dialysis. And that's the problem, identifying those patients. Some of the laboratory tests out there, for example, that the Kidney Foundation has been an advocate of, trying to get a standardized test so that every time you get a blood test drawn, your primary care doctor is told what the percentage of your kidney function is. Because you don't have symptoms, but you may have kidney function that is 40% of normal. So trying to get the public educated, to get PCP educated, that's what we're talking about here.
There has been some concern expressed that Medicare offers a more comprehensive benefit than some private clinics do for dialysis patients, and therefore by pushing the Medicare benefit 12 months is going to perhaps harm patients.
Yeah, I think you heard a little bit of that from the individuals in this spoke. The truth is that most private payers and managed care companies have programs in place, in particular disease management programs. In my area, I have approximately 20 or 25 patients who are in either Aetna or one of the blue plans, who have case managers assigned to the patient. And the case manager will do home visits and will make the patient may have too much fluid on them that day and don't realize it. I'll get a phone call from the case manager to say maybe the patient needs dialysis sooner. That does not happen in Medicare. So there are more, in many cases, benefits available in private insurers that are not available for Medicare patients. I think you heard that in particular a little bit earlier.
In preparation for this presentation, I was very surprised that misinformation is out there. It was not a pleasant day when I switched from private insurance to Medicare in terms of the quality of coverage and the breadth of coverage that the private insurers will pay for. It's the first question that you, as any dialysis patient, hears when he goes to see a new specialist or another physician is, are you on Medicare or are you on private pay? So that's fact.
Well, thank you very much for showing up, Representative Christian, for making your comments. We really appreciate it. Thank you.